if we were to choose each of these different offerings that you just went over, I'm assuming it's not just one bulk price, right? Each item, the added cost.
Yeah, you know, everything we've talked about here today is around that 875 PEPM range, but certainly as you don't need services or tools, et cetera, and including, which we haven't really yet talked about, our member portal is included in that number. That's our all-in, everything we kind of offer number, with the exception, of course, of if we were doing on-site lab and biometrics, there's, you know, that's a pass-through, $55 or something like that per test. But outside of that, excuse me, that includes everything. So as you don't need services, that number will certainly go down.
Okay.
Think of something else. I think it'll come to me once we get started.
Yeah.
Let's go ahead and get started with it, I guess. Yeah.
I think we're ready to rock and roll with the demo.
Okay, great. So
wait. I remember what I was going to say real quick. If we change our wellness point or anything like that, is there an additional fee for that or any kind of programming?
I'm sorry, Nick, you kind of broke up. Could you repeat that again?
Do you have any kind of like we got the wellness points or we need something else programmed? What's the fee for that? Additional fees?
You know, generally, I'd have to kind of price it out. Heather, do you have any sense of that?
Usually there's a setup fee. If there's small changes, that's usually included. If it's a complete overhaul, then I believe it's like a half the price of the setup fee. But don't quote me on that, Michael. I'm not 100% sure.
I think you're right. And typically where we have heavy lifting in the way of implementation, you know, it's usually not more than like 11 or 12,000. So if, again, just as a straw model, consider half of that if we were doing, but again, I think if we could just get after today, if this makes sense, we can get down into the numbers and really carve that up. This has to make sense for you guys, you know, before we go too far.
Okay.
So I'm going to turn it over to Heather. I'll be listening, but trust me, you guys don't want me driving this part of the demo. So Heather, it's all yours, and thanks, guys.
All right.
Hey, thank you, Michael. I did want to let everybody know that I am recording this, so just so everybody knows whatever we say is being recorded. So this is the My Pathway to Health landing page. This is our members portal. Something I heard you talk about earlier is and correct me if I'm wrong, more of the inability to be able to collect all this information and be able to have a place to store that. Is that correct?
Yes.
Okay. So as I'm going through this platform is really a building block. So think of this as the foundation. Everything within this portal is automatically transferred over into what we call a health management system. The health management system is also something that you can go ahead and lease and use as well. So this is really a way to go ahead and gather all of that information, but then it also transfers over to another system that is easy to be able to use to go ahead and manage that. So I'm going to show that to you as well. There are two different ways for members to go ahead and access the portal. If you have your own intranet site, we can certainly have single sign-on ability through there. Your members would go onto your website, go to their wellness part, and then just easily click on to their portal. If you want to have a standalone product, that's absolutely fine as well. You provide us an eligibility file, and only those members who are eligible can register. That way we make sure it's secure and it's HIPAA compliant. Each member goes through a short registration process, creates their own unique username and password, confirms it. From here on out, they simply just log on. Let me go ahead and get here into the portal. Now, each time the member logs in, what's going to come up is called an action list. And kind of think of this as a leaderboard. This is going to let your members know all of the different things that are required in order for them to qualify for the program, and then their status accordingly. This is completely customizable for you. So as you're with us throughout years, you can change this as your program progresses, but this allows the members to be able to easily see what's required and whether or not they've met that requirement. Green check mark means it's done. The red X means this is something they still need to complete. That way it's going to cut down on all of those inquiries to you as well. What do I need to do? Have I completed it? Will I earn my incentive? Every time they log into the portal, it's right here for them. Let me quick mention before I go through some of the tools and resources is everything on the portal is also available in Spanish. So by clicking the language at the top, the entire portal will then be displayed in Spanish, where members who are more comfortable in that language can easily read and then respond in that language as well. To also mention, we do have support staff and coaches who also speak Spanish, so are able to help members if they are having any kind of problems navigating through the system. Through the portal, the member is going to be able to go ahead and complete the Know Your Numbers questionnaire. This questionnaire is what we consider vastly superior to your normal health risk assessment. Instead of just asking those standard questions, the way these questions are worded and are extracting the information, it's going to provide the members with a very comprehensive report that's going to let them know where their health is and where it's leading them to in the next 5 years. That way they really get a better look of their health, of different ways to start making changes, where their risks are, but really understand where they are as well. So the test is very easy to go through. They just simply go ahead and fill in the blurb that best describes them. If you do go ahead and miss any of those questions, it's going to let you know exactly what those questions are, and then you can go ahead and easily answer them because it's very easily highlighted for the members to see as well. So once this is done, they do get a congratulations page that is displayed for them, and then it's also emailed to them, so your members have that for references. Now, I heard you did say that you do biometric screenings. We would be able to take the files from your screening results and automatically load them into the system and populate each member's portal. The member does get an email letting them know that their results are on their portal and able to be viewed, and they can come to My Screening Results to see that. What we do too is we keep a history of the results. So if you do have your history of results for members, we can automatically load them, or as you're with us throughout the year, each time that member has that new screening, it's going to be uploaded for them. They look for the screening date they want to view and click onto Your Data. It's going to show them all of the tests that were done and then their associated value. Now we know that your staff is going to answer any kind of questions they may have, your nurse practitioner, your doctor, but the members may go through here and see the results before they actually speak with their doctor. Everybody's clinical knowledge is different. We understand that. We've heard the terms LDL, HDL, but we might not know what that's measuring. So by clicking onto View Description, it's going to take them through and explain to them exactly what all of these tests are measuring, why it's done, national standards, so they can kind of see where they fall, if they have risks, what those risks mean. But it really gives them an idea of where the results fall and why these tests are being done before they do either speak with their doctor or a health coach, whatever it may be. Now, once we have those results, they're going to be imported into that completed KYN questionnaire, and then you're going to be able to see all of your different reporting. These are very, very comprehensive reports that's going to go through and explain all of those variables that were captured from the KYN and the questionnaire. Now, all of these are kept on the portal. They come up in PDF, so they're very easy to print out. So if they want to print them out before they come and share that with your doctor, your nurse practitioner, or just to be able to have a hard copy to read, that's all easily kept for the members, and then it's kept in history so they can go back at any time and view those. Now let me show you a little bit about this main dashboard page, and this is what's directly underneath that action list when they log in. What they're going to see is their health focuses. These were the areas of risk that were identified through the KYN and biometric screening. Any of these focuses the members can click onto, and once again, they're going to be provided educational links. It's going to let them know what they are doing that's triggering them to have this particular risk. Any kind of medication or testing might be recommended, but it gives them a source of knowledge to understand these risks, why they have them, but more importantly, different ways to make lifestyle changes to start lowering these particular risks. They'll also be able to see their risk score. They're going to be able to see their risk score next to their peer group. That way they can really gauge as into what their what their health is next to the other members that they are working with. The next thing they'll be able to see on this main dashboard page are the different trackers that they are actively engaged in. The best way for the members to go ahead and keep track of all these activities is to go ahead and sync up with a fitness device. By coming to the fitness applications and going into our marketplace, they're going to be able to see all of the different devices that they can sync up with. Now, we currently show the top 16 market-leading devices, and the reason why we chose these to display is because these are the devices that have shown to work most consistently across the board. And with these devices, they can also sync up them with all of those smartphone apps. So the member may be lose it off of their phone, they can connect it to Fitbit. Fitbit will then transfer all of that information into their portal. Now, if you have a particular device that you don't see on here, we can easily go ahead and display that, as well as we can go ahead and sync up with any device out there, including the glucometers, the scales, anything it may be. To go ahead and sync is very easy. You go ahead and look for your device. I have a Fitbit, so I'm going to go ahead and hit connect. It sends me over to that login page, so I just go ahead and type in my login information for Fitbit. It allows me to choose as little or as much information as I want sent over. I hit allow. As long as I'm syncing my device, all of my information is going to flow in there. I never have to resync it. It will come directly here for them. Now, what's really great about this as well is on that HMS system, you can see all of this as well. All of this is transferred over in real time. That's going to help you and any coach go ahead and do more meaningful conversations, because you have all of this information very easily able for you to be able to view as well. Now, we know not everybody is going to use devices. The members can go ahead and up-track trackers manually as well. By clicking on to view all trackers, you're able to see all of the trackers. We have more than 14 built here in the portal for them to use. And then once they click onto one of these trackers, it's going to be put on that main headline page. Now let me show you how easy it is to go ahead and manually update. You don't need to type in the date. You simply choose it from the calendar. In this case, it's weight. I add that in there. I hit add entry. I'm done. It's simply that easy. Now, not only from the desktop or laptop can the members manually enter this, but they can also do this mobilely. We have an Android and an iOS app. So exactly as you see it here, they can go ahead and update any of these trackers from there as well. That way they're not tied to a desktop or laptop. They can do this mobilely and update their exercise at the gym or any kind of maybe food journal that they're keeping track of through their smartphone. Now, what the portal can also do is then also have the messaging capabilities. Through the health management system, your coach, your nurse practitioner, your doctor, whoever you may give access to, would be able to go ahead and communicate back and forth through the portal to the members. Members can go ahead and send in messages to the doctor, nurse practitioner, coach. They would choose from the subject body, hit type in the body, and then hit send. As soon as they hit send, it's going to go to that assigned coach's inbox. That way the coach automatically gets that, and they can go ahead and respond accordingly. Now, this option is also available on those smartphone apps. That way that line of communication is that much more seamless, because they can go ahead and send and receive messages directly from their smartphone. And the way it's set up, it's very much like text, but it is secure. So they can go ahead and have that line of communication with the wellness coordinator that they may be working with. Now, before I go on with some of the other tools and resources, are there any questions so far?
I have a question.
Yeah.
You said the communication is forwarded to the assigned wellness coach.
Yes.
Do you mean like the wellness coach? The wellness coach is built into the software. So
no, it would be actually assigned to a person. So if you're using our coaching system, the way we assign coaches are dependent upon risk. If the member just has lifestyle issues like exercise and nutrition, they would go to an exercise physiologist or a dietitian. If they have chronic diseases, they would go to an RN. Now, if your system, if we were going to go ahead and lease our health management system and use the back-end portal, you would assign very much the same way. If you're going to have a wellness coordinator go ahead and do intakes and then assign them whether or not to talk to the nurse practitioner, the doctor, or however you're setting up your program, that can all be configured in the background. That way the members aren't having to go through multiple drop-down boxes. It's done for them back end.
okay.
Does that make sense?
Yep.
Okay. Okay, let me show you a couple other features because I do want to quickly touch on some of our other systems. We know gaming is, sure.
On the wearables, do y'all do the Apple Watch?
I'm sorry, hang on one second. Okay. Go ahead.
Do y'all do the Apple Watch and iHealth? Okay.
Yes, we do. We do support iWatch. It's a little bit different of a configuration. iWatch actually has to be integrate or synced up with Jawbone, and then Jawbone syncs up with, which I know is a strange thing, a way of doing it, but that's just the way the iOS system is set up.
Okay. All right.
Yep, but yeah, no, that all can be in there.
Okay.
As we know, gaming is getting really big. There's a lot of people who really respond to that. We do have a gaming capability built within here. This is a wellness game. What it's going to do is send out the members different challenges to complete throughout the day. The challenges are based upon the members' physical capabilities, and also how often they would like a challenge sent out to them. So they can go ahead and configure that with their day. If they want one just sent out every 2 hours or every hour, they can do that. They have that entire either 2-hour span or 1-hour span to go ahead and complete these challenges. And it can be something as simple as drinking an 8-ounce glass of water, walking around your station for 30 seconds, to doing squats. So it's something just to get the members moving throughout the day, and kind of gives them a little bit of that mental clarity, but make sure that they're not being sedentary as well.
Hey, Heather, and to that point, I mean, you guys have probably heard in the industry sedentary disruption. That's what this is really designed to do, is so you don't look up from your desk and you've sat there for 7 hours straight, right? So just a little, motivator to get up, stretch, move, drink water, whatever the case may be. And then we also have, the typical challenges, taste the rainbow, walk so far, et cetera. And Heather, Nick shared with me yesterday, they are contemplating through Mike Tinney, some of the zombie challenges, et cetera, as well.
Oh, great. Okay, the walking challenges, yeah. And those would be something they would be able to very easily go ahead and earn points through the portal as well, too. Speaking of that, let me go ahead and show you that so we don't miss on that. That would be through that activity scorecard. This is where you choose those activities. As you can see here, this is not a complete list, but this is for demonstration purposes. We give points for the health screenings, the KYN, any of the trackers you may do, the walking challenges, whatever you choose, that will be put here on the list for the members to be able to see. By clicking onto any of these activities, it's going to tell the member a little bit about that activity, give them some program year information, but it's going to show them each and every time then that they earned a point. They'll be able to see the date and then the point accordingly. That way they're able to keep track of whether or not they've met the requirements and are earning enough points. this is where I would go ahead and run the report off of for you were talking about for your check company, whether or not they earned the discount, because this would keep track of it, and then basically it would be an aggregate report. Yes or no, did they complete it? That way PHI is also protected, but you would be able to send that over very easily for those members who did or did not qualify.
Okay.
Let me just show you a couple other things. We do have a decision dashboard for the members. This way they can go ahead and search for any kind of medical topics. We also have an interactive symptom checker. These would be for those day-to-day health situations that come up. You can look whether or not you're looking for a man, child, or a woman. Let's say our child woke up in the middle of the night and they have abdominal pain. What happens is it's going to ask them a series of questions. At the end, it's going to let the member know that this is something they need to go to the emergency room for immediately, that this is something they should talk to their doctor about, or if it's non-emergency related, different ways to treat at home. The site does strongly stress that this by no way would ever take away from the advice of your doctor, but it has shown to give the members good information and to be able to treat at home and cut down on those very expensive emergency room visits. Okay, I'm going to stop on this portal. There are many more, as you can see on the side here, tools and resources for the member, because I do want to quickly be able to show you the back end and then also the administrative portal as well. So do you have any questions on this? Something that maybe you didn't see that you were hoping that we had?
The daily and, I mean, I guess they could be hourly challenges that y'all mentioned just a few minutes ago. Those are really cool. Or do we also have the capability to do monthly or quarterly challenges?
Absolutely. Anything you want to set up. Now, are you thinking that there would be a leaderboard in the portal for that? Is that what you're asking for?
I don't really know what a leaderboard is.
Well, like the gaming in here, the members can easily go on and be able to see where they are with that game. If we did put a monthly challenge together for you, we could definitely keep track of that on the portal, whether it be how much exercise they were doing, water intake, calorie intake, different ways of that way. We could definitely keep track of that, but there's not like something that comes up that says Mary Jo has 10 points, Jerry has 6, and Ralph has 9.
Okay. What if we did like a steps challenge that lasts for 3 months, and the challenge is to walk 10,000 steps per day every day for those 3 months?
Absolutely. As you can see, there's a step activity in here.
Mm-hmm.
You just give us the parameters, and then the parameter will automatically give the member the points as they earn them. So
Gotcha.
like you're saying, if they have to have at least 5,000 steps a day, that would be put in there, and then they'll be able, the reporting is able to be generated in any kind of time frame that you want. So then we would be able to pull from the duration, whether it be 6, 12, up to 3 months, whatever you would want it to be, to pull out who earned those points for qualifying for meeting those requirements per day.
Okay.
And as you can see, we can also do that, like I said, with calories burned. So you do have a lot of different options for challenges within the portal itself.
Gotcha.
On your single signing, go ahead.
Well, I just wanted to mention too, and of course we'll help you with any kind of communications as well. So when you put these challenges into place, our marketing team would help go ahead and format a flyer for your members to be able to know how to join, what the qualifications are, what the time frames are. We help you create all of that.
Do y'all do notifications too if we have something going out?
Yes.
On the phone?
Great.
Absolutely. For single sign in, if they sign into an ADP account, can you use their sign in to go into here?
And what kind of account is the, I'm sorry, you kind of broke up. You said
ADP, yeah, the payroll.
Again, that's something we're going to have to look at. When it comes to payroll, what I'm thinking is their servers have very high security measures. So we would have to talk with our developers how that would work if we could, you know, again, it depends on what kind of access and security that they do have on those accounts. I know we have no problems with the internal intranet sites. I'm just not sure when it comes to something like payroll. We do integrate with Epic and other areas like that, so I know there has to be a way. But with the payroll, I'm just not 100% sure.
Yeah, so that'll be one of my homework assignments, but I know we have integrated with other like HR, human resource admin tools, so let me check on that. Worst case scenario, I think we could embed a hyperlink, you know, that takes the member there, but let me find out before we go too far with that question.
Okay, sounds good. Is this, is there, okay, so our population is an older population here. So the dashboard, is it, I guess, is it pretty much simple as this is to navigate through?
This system I'm showing you now?
Yeah.
Yes, it's very, this system has the ability to go ahead and give you a lot of information. If this is something that you use, we do not throw this at you and, you know, in a wave and go on. There's in-depth training on how to use all of this, how to do the messaging capabilities, where to find the information. You even can go so far as if, I don't know if you're self-insured. If you are, we have the ability to go ahead and link up with your claims, where that would also be shown in this system as well. So this is a very robust system, but you do get a lot of training on it with a training manual that helps you go through that. And across the top here at any time is also a user manual that comes up that will help you go through and answer any questions as well.
Okay. On the back side, how long will it take for training on this?
We usually try to do it in 2 or 3 days. Again, we want to show you it, but probably the best way to learn and to understand it is to kind of go through it yourself as well, and then come back the next day with questions. So we do it over a couple days.
Okay.
And then at any time, your account manager is also always available to answer anything and to do more training.
Okay.
Okay. So let me just kind of go through what you have the ability to be able to see. Each member will have
Heather,
an account. Yep.
Sorry, real quick. Let me just do a quick time check. Are you guys, Nick, Sam, are you guys okay on time for a few more minutes?
I am.
Yeah, I'm good.
Yeah.
Okay, great. Thanks, Heather. Please go on.
You're welcome. I'm sorry. This is like a main dashboard page for each member. So this is what the coaching staff or doctor staff would be able to see. You'll be able to have a phone number as to how to reach out to them, give them a little information. You're only able to see but then give them your last 5 statistics. Through here, you can go ahead and schedule future communications. So if you do have a wellness coordinator and the member needs to be reached out to, yes?
Sorry for the interruption. Gentlemen, can you hear Heather okay? I'm getting some drop packets.
I am too.
Okay. Maybe just wait 10 seconds, Heather, because you're kind of getting that dropped packet thing you get with using voice over IP.
Sorry.
Yeah, it's still occurring.
Can you hear me okay?
I do fine. I do apologize that it's me. Let me see, I just picked up my handset. Does that sound better?
It's about the same.
Okay. I can try calling in on my cell phone.
Well, if you don't mind doing that, I'm having a hard time hearing you. If you don't mind calling in, we can wait just a minute.
Okay, absolutely. Just 1 second.
Sorry, guys. I was just having a hard time hearing her. Hope you don't mind the disruption there.
That's fine. Mike, on the code, so if I have a question, I always have a question, they want to meet with the coach, direct them to Sam?
So sorry, I was getting a little bit of what we were just talking about, Heather. Could you repeat that one more time? I'm sorry.
Oh, this is Nick.
Okay, I'm back. Is this any better?
Yeah, that's a lot better for me.
Nick, Sam, is it better for you?
Yep, that's better for me.
Okay. So, I think Nick was just asking me a question. Could you repeat it again one more time? Sorry.
Yeah, on the question, if an employee has a question and they want to message the coach, message Sam, I guess I was confused on that part.
It would depend on how you want to set up. Go ahead, Michael.
No, I was just going to. You're going exactly where I was. It depends how what protocol you guys want. We can send it. We can have them go directly to Sam or someone on his team, or if you're using our team of coaches and nurses, then it can come to us first. If I understand your question, it's kind of how we set it up.
Okay, all right. Yeah, I want to say, like, for the wellness coach, maybe we could do that, but of course the nurses and stuff would probably be best to have that going to the clinic. So.
Sure, good idea.
So I'm just going to quickly show you some of the features. You can go ahead and schedule those future follow-ups with members. That way, the coaching staff, you, Sam, don't have to have your separate date book to go ahead and do all of that. You can go ahead and here pick through the calendar. It's automatically going to default to whoever signed in, but you can also assign it to the other members of your team. You can add little notes in here. So if you want to make yourself a note to make sure you're talking to that member about that, once you hit schedule, it's going to put it into a queue that comes up every morning for you that you can go through and make sure that you're doing all of your follow-ups for that day. And then your note will always show here as well. Down here, you're going to be able to see all of the different trackers. By going ahead and clicking on, you're going to be able to see exactly where that tracker came from, whether it be from a device or manually entered. You're going to be able to see when it was entered, all of the information. So the date measured, date entered, steps. And if you go through, I think I might have some manual in here that, I'm not going to take up all your time, but you would be able to see exactly where that came from. The next thing you're going to see are all the different areas of risk the member was identified with. Something we use is the intrinsic methodology, so we apply status of change. This is just how willing the member is at this time to make changes. This is something you can or can't use. We use it for a coaching style. You can always add more conditions as well. So as you're talking with the members and they're identified with different risks, you can add that. We do have health programs that you can use or that can be offered to the members. It works very hand in hand with the coaches. They go ahead and go through here. They have different week sessions they need to complete. And then the coach would either complete them or reject them to go ahead and make sure that they go ahead and complete those different areas. The next thing you're going to see is the correspondence. This is going to be the interaction with the members. This way you can go ahead and note and keep track of that. You can kind of see what kind of type it was, whether or not you send a letter out to that member, whether it was a phone conversation, your secure messaging. This is where you would be able to go ahead and message the members as well. It would come up. You can choose from the subject, type in the body and hit create. Your message will, let me just go ahead and put in here because I want to show you that it's.
This is the backside, right?
This is the backside, yes. So once you go ahead and send that message as well, you'll be able to tell whether or not that message has been read or unread by your member. So it'll remain unread until that member actually clicks on it too. So that way you can make sure that they are seeing all of your messages and reading them. Down here, you will have all of the biometrics easily stacked. That way you don't have to click into different days and try to gauge where the trends are for the member. It'll be able to be easily seen because they'll be the newest to the oldest stacked. That way you can go ahead and see any differences that strike you out. You'll be able to go ahead and view the KYN questionnaires by clicking onto any of them. It's going to bring them up. and you're able to see exactly how the member entered any of those questions. You'll be able to have access to that scorecard as well, so you can see where those members are earning their points if they have any kind of questions on that. If we do have your RX claims, they're going to be automatically populated in here. You'll be able to see what the members are taking and even their fill status. This is something that we find very helpful for the simple fact of whether or not the members are getting that filled as they should. Sorry, it's running a little bit slow here. Through here, you can go ahead and attach documents as well to the members' profiles, any kind of lab results, doctor notes, whatever it may be. You can go ahead and add that through here as well. So I don't want to take a lot of your time going through this. Something else I should probably show you as well that would make coaching easier. We do have work queues for the staff to be able to go ahead and work off of. And once the KYN and screening is done, dependent upon their risks, they'll be placed in these queues. That way you can really tailor the outreach to those members, because you can see where their risks are, if they're in one of those categories of being healthy, all the way up to your chronic. And then down here is where we'll customize queues for you. So if you have particular programs that you run directly through your clinic, you would give us the clinical parameters that you would want the members to have in order to qualify for those programs. We put that into the system. Every member who does the KYN and biometric will be filtered through there. And if they have those qualifications, they'll automatically populate those queues then for your staff to go ahead and outreach and get them into those programs.
And
so that is a
real quick,
very high level.
Let me just interject real quick. Remember, guys, this is what you're seeing now is that back-end system that the health coaches would use, whether that's your team or our team. Our team uses the same program. So whether we're sharing type resources or you guys are picking up in certain areas, the nice part is you kind of see what functionality we have, whether our coaches are using it or yours. Does that make sense?
Yeah, it does.
And then it allows you, since you don't have that capability of having a place to store all of that information, it gives it to you right there for easy access. So let me quickly just show you our admin portal. I won't take a lot more of your time. You'll have access to this as well.
Question about the coaching thing you just went over?
Yes.
How will the portal push those individuals? Will it push those people to us who we need to reach out to if, for example, they haven't completed their HRA, or if there's things that they have to do? Will it notify us, or do we need to take it upon ourselves to go find who hasn't completed certain activities?
What it's going to do is it's going to populate queues. So if a member has biometric results but has not done the KYN, they'll be put into this queue, or vice versa if they've done the KYN but don't have biometrics. So you don't have to go through your entire population. What you would do is go into those queues to find those members.
And then I could take it upon myself to contact that person?
Correct. I'm trying to find one.
Well,
I don't think.
Yeah, and how to correct me if I'm wrong. Unless if you're using our nurses and our navigators, kind of that front end system, back end system, but for client or member facing tool, we can do some of that outreach and say, hey, it may not be a clinical person to say, hey, Michael, you didn't complete your health risk assessment. Was there we're happy to help you walk you through it. Was there an issue? We can certainly do that as well.
Okay. And
we have a lot of hybrid models.
Let's say John Doe he did his biometrics and his cholesterol is in the 500s. Will one of your health coaches or whatnot, will they outreach that individual?
Yeah, typically whatever or either clinical threshold we're setting, or you've asked us to set, or based on the various colleges of whatever medicine the parameters are, provided you guys have first right of refusal to tell us what you think, especially given you have an on-site clinic and physicians on board there. So we'll follow your lead on what the clinical protocols are, but absolutely we can do that.
Okay.
Where there are care gaps, so like Heather said, where there's a prescription that wasn't filled or ongoing isn't refilled, we can do a lot of that heavy lifting for you.
Gotcha.
Through this admin portal, you'll be able to go ahead and run any of these reports that you want. As an account manager, you will receive reports set up in the duration that you want, whether or not you want them quarterly, bi-yearly, yearly, however it may be. You'll set up that cadence. But of course, there's going to be one information that you might want to pull at any time. So you'll be able to go in here and be able to pull any of these reports yourself. One of the things that you may want to look at is to see who's done their KYN and who has not. So you can go ahead and put in the dates that you want to see who completed the health risk assessment from. And I'm just going to do a whole year here. I go ahead and view report. Now, what it's going to do is it's going to allow you to either download this as a PDF that you can see automatically, or down into an Excel spreadsheet. The majority of the time we do Excel spreadsheets. That way, especially if we are sharing any of this, we can go ahead and take out any kind of identifying information, whether it be a social, birth date, whatever it may be. But this is going to show you then very much in detail in this particular report, who registered, who did the HRA, what the biometrics are completed, did they view their reporting. So it allows you to be able to go ahead and kind of gauge as to where your population is, do outreach to those members who haven't completed everything. Another one I think you would be is this incentive participation. This is where you're going to be able to bring up whether or not they qualified. It's going to bring up all of your activities, the members, and then all the way at the end here, it's going to show their total points. So if you have core requirements like the health risk assessment and the screening, you'll be able to see those there, and then a total amount of points of the other activities they kept track on. So you'll be able to pull that up at any time as well. Any other questions, gentlemen?
I do have a quick question. There's obviously an admin, or there is admin access available, but what if we wanted to take it upon ourselves to create a challenge? Could we do that, or do we have to go through Orthus?
No. Nope, you could absolutely do your own challenges. We see that a lot with community-sponsored 5Ks, blood draws, whatever it may be. What we could do is within the portal itself, there's something called a special activity. I don't see it on this one, but you would just provide us a spreadsheet with the names of the people who went ahead and participated in that particular event. We'd be able to load that into the system for you. And then it would show underneath special activity that the member, let's say, did a 5K, they earned 5 points, and then it's also then going to be generated onto the reporting as well.
Gotcha. Okay.
Yeah, and to kind of close the loop on that, so we sell, and I know we threw a lot of acronyms at you guys, but we sell that we call HMS or back-end system to hospitals and health systems and even other wellness companies that are looking to provide some type of repository of all that data. So just know that what we're showing you is really designed to be, once trained, you guys can hold the keys to the kingdom and do with it what you want. There are just some general blocking and tackling things that make it much easier for us to do, so you don't have to go, how do I remember to learn to log in and put this, spreadsheet in here? We can do some of that, but the design and the idea is so you can stay as autonomous as you want.
Okay. And then on that same subject. Sorry for all the questions. Let's say we kind of had a random event going on at the casino, like some kind of health expert come in and do a little seminar / presentation thing, and we wanted to update the incentive list and throw this health seminar in there for 10 points. Is that something that we can do by going in on the back end and updating the different activities, or do we have to go through you guys to have that event put into the software?
You would actually have to go through us for them, because that is code in the background. So that
Okay.
needs to be set to be able to be released into your portal.
Okay.
Is there? We're looking at the main page, right, of what the associates will see.
The main page, okay?
Yeah, is that what they're going to see, or do they have something like a quick snapshot of what's going on?
This is all of their main health information. So across the top here, that again, their focuses are going to be, and then the trackers that they're engaged in. Once the reports are generated as well, they'll be able to have their reports right here on their front page. So it's kind of all of their main information, and then the tools and resources off the side. And where this Orthus Health is, I failed to mention earlier, you'll be able to go ahead and put your casino logo here as well. That way it's branded for your wellness program, or if you have your own wellness logo that you use, it would be replaced there where the Orthus Health is.
Okay. We do the colors and stuff like that.
Absolutely.
What does the app look like? Do you have the app part of it that we can take a look at?
Yes, if you want to go ahead, you can go ahead. Do you have an iPhone or an Android?
Yeah, I have an iPhone.
Okay, just go into the iTunes store. It's My Pathway to Health, and you can download it. You won't be able to log in because you won't have a user, but it'll give you a general idea of what it entails. But members would sign on with the same username and password that they do for their portal online.
And you know what we could do, Heather. I don't know if you have the capability to mirror, but we could, show you. Well, I guess that's question one. Can you mirror? Can you show your phone on your screen?
I've never done that before. I don't.
No problem. Yeah. So I can send you guys some screenshots or show you. So we can set up another quick demo just to show you what it looks like on the phone. But it's like what Heather was saying. I know things don't always translate from web portals, using browsers into apps, but it's largely being 95% what you're seeing there. It's just on a condensed version. So very similar. But I'm happy to do that if that's a takeaway we want to go down.
Okay, yeah, definitely, because our population usually uses cell phones for everything. So we notice that we get better results if they have an app or something that they can get on and log everything in, or even take the survey. And that's another question. If we create a survey, can we put a survey on here and see who takes it?
Yeah, I mean, if you have an example of that, the short answer is yes. The question becomes how detailed is it? Because then it could get into coding issues. I don't know. I just would have to take a look at it, or give me some sense of, all the details, what you're looking to grab.
Well, the survey is something like you do. You don't want it like a fitness, a gym on property. How did you like the health fair? Stuff like that.
Gotcha. Good question. Heather, any thoughts?
I know we can add questions on top of the KYN. Are you thinking of a standalone little survey?
Yeah.
Let's just take that as a take back, Michael. There has to be the way, I'm thinking underneath the getting started page, they would have that capability, but let's verify that with development.
Okay, great. Because right now we're doing surveys, but it's like with SurveyMonkey, and we're trying to figure out how many people it takes and stuff like that. So I think this would be a great way to do it.
Yeah, so that'll be my second homework assignment to find out for you guys. Absolutely.
Okay. All right. And on the claim side, you said they don't fill their prescription and stuff like that. That's going through our TPA.
Yeah, we'd get the data typically from your TPA, just sent into us, and typically it's a once a month claims file. They, sometimes it takes a little bit of twisting the arm, the first one, but it's your data, so we make it super simple for that TPA. They just send us pretty much the data, and we'll put it into our format so they don't have to go through any time or expense.
Okay, all right, okay. Because we have a pharmacy too, so I was just saying if if it's time to pick up the medicine or something like that, any kind of notification or hey, you forget your medicine or something like that, if y'all would do anything.
Yeah, I mean, as long as we can get the claims. It's all predicated on getting the medical and pharmacy claims whatever the source is. We'll make it useful. It's just a matter of can you get access to getting the claims dump sent to us once per month or however often they run that push.
Okay, all right.
I mean, getting it from the clinic wouldn't be an issue, obviously, but I think
you would have to get it from your UXC.
Yeah.
Well, and if that's pushed through the EHR or EMR, then that's probably less of an issue, but not sure what kind of back-end system they would be using to manage the pharmacy component of it. Are they do you have a separate PBM or pharmacy benefit manager, or is it just your TPA acting as both? Do you know?
I think what Daniel takes care of that?
Yeah, I think it's separate.
Okay.
Because I mean, premise the software, the claims tracker or whatever you want to call it that premise is using is totally different from what Kashada's TPA is using.
Okay. Yeah, that's
so.
It shouldn't be an issue. Yeah, it shouldn't be an issue, but we can certainly look into that when or if you guys are ready for us to do it. I mean, at the end of the day, it just comes down to just being able to get access to the data. And again, since you own it, if you can wring that arm a little bit, sometimes it's a real nice little nudge. Sometimes it's a pretty hard tug, but once that happens, we can put it into our system pretty easily.
Okay.
I guess can we get an estimate on a price?
Yeah, I'm happy to work up a quote for you guys. Outside of the back end system, which I guess that's the question for me. Like I said, everything we've kind of shown you except for access to HMS, and now that's a kind of a separate question. Like how much or how little would you guys want to use it? How much access do you want? But outside of that, everything else we've talked about, portal, analytics, coaching, all the other stuff is around that 875 PEPM range. Provided that's in fact what you guys are looking for. Was there anything you were thinking you didn't want? Or maybe didn't want to get a quote on right now? I can line item it out so you see what each piece is, but I don't want to just throw something at you guys that you, oh, sorry, go ahead.
Yeah, go ahead and do a line item for us and we can see. Because right now, I like what we see right now. The games and stuff like that. So, yeah, if we can do a line item, we're looking at approximately 1,800 to 2,200 employees. I have another question. What we're going to do is that with this Friday, well, now before all the associates, I guess, to get in, we need some employees that aren't going to have can take part of it, but they won't be able to get the the deduction. So they had to work
Mm-hmm.
here a year, stuff like that. So is there a way to do that if you get the hiring information when they were hired and all that?
Yeah. So
Yeah.
are you guys yes, short answer, yes. Are you guys offering this to kind of mid-year hires? Is that the plan?
Yes, I believe so.
Okay. So yeah, as we get an updated eligibility file, and now we're starting to get into some of the blocking and tackling, which we're happy to do, but I don't want to take you guys down a hole that you're not interested in going down, but we'll get an eligibility file typically sent once a month saying, Michael's no longer an employee, Sam is, he's eligible, and that will be kind of the bellwether for who's allowed to be included and who now has access for the portal, et cetera. So that's the one thing we will definitely need from you guys.
Okay, all right, because that's what we're looking at. And like I said, if they aren't eligible, I don't see them getting on the portal until it's time. So,
Right.
okay.
Oh my God, anything. I'm impressed, y'all. I like it.
Well, thank you. Heather's been here with us for a long time, so she's been part of the development and architect team to help make it so. So I'm always glad for somebody to give her good feedback. We think we're onto something really unique, and sounds like you guys see that value as well. So my three things that, and again, call me, send me an email with any follow-up questions, but my three things are to check in on ADP, the connectivity with them, the opportunity, ability to add surveys, and of course, just a line item quote or pricing model for you guys. Anything else that I've forgotten or you'd like to see?
Some snapshots of what the mobile device looks like. Like the simpler, the better.
Yep.
I still don't want to overwhelm them with too much information on the front page.
Okay.
What else? Quote. Let's see. Also, if we do decide to go ahead and we'll get the contract from you and stuff, and we decide to go move forward with it, we might need to get y'all to fill out a vendor information packet, and it all depends on how much it is, and we can go from there. We can talk about it further once we look at everything.
Yeah, absolutely. We have to go through that step or process often, so no problem. Also, too, if we need or when we're ready, there's going to be a BAA or business associate agreement, and arguably, I'm sure you'll want us to sign an NDA, which we're happy to do. So I'll include ours, or you guys can send me yours, whatever you want, and we'll get that process started as well. So that would be great.
Okay, great. Yeah, we're looking. We got to make a decision pretty quick. We're looking, hopefully, to have everything up and running by February 1st. And so, like I said, it's going quick. So just see if we could get that.
Yeah. Heather's kicking me virtually under the table saying February 1st. Thankfully, we've had a really good year and we're going through a lot of implementations. So that's not just like a sales guy saying, hey, sign now. I mean, really, the sooner you guys make a decision, and I know part of that's incumbent upon me to get you your information you need, but I'll do my part as soon as possible. So know that even I'm off tomorrow, but if anything over the weekend or, pops up, given that you're on an expedited time frame, let me know. Send me an email, give me a call, and I'm happy to make myself available so we can try and help you guys make some decisions here soon.
Okay, great. And then you said there's another port to this?
Well, the only other component would be the HMS, which the back office or back end system for your clinical team. I'll put that in the quote so you see that as well. I think that's the only part in my mind how much variability there is, because if Sam and your team are doing a lot of the legwork, then it would be, it could be a very nominal cost. It could be, it could add $1. It could, be less. It just really depends on, how much functionality you guys want. So what I'll probably do is put in on that side, put in, I'll call it best, but the most expensive access you guys could have, where basically you're running everything all the way down to kind of us managing it as well, and give you some cost there. But that would probably be the only piece we'd need to talk through and say, okay, well, this is really what it looks like in our minds, to get an accurate price on the HMS system.
What is HMS?
It's just our health management system. That's the back end portal for the coaches.
Oh, gotcha. Okay. Yeah.
So that's the only question mark for me. But Sam, I'm sure you got it in your mind what that's going to look like. But I'll put in some markers as to what the definition is of kind of that good, better, best, and the associated pricing.
Okay. All right. All right. I think that's all I have. I guess I have another question too. If we do like this zombie challenge and the run, is that implemented? Is it embedded in this, or that's something separate?
We can do it one of two ways. Have you signed a contract with Fix or Fit yet on that?
Not yet, no.
Okay, so there's one of two ways. We can either include it in our price, so you're paying 1 PEPM, or the contract would be directly with them. Either way, we've got a great strategic partnership. It won't add any cost. Whatever price they're charging you guys, I'm sure it would just basically be a pass-through. You just get one bill from us to do it, but we can certainly embed the Fix or Fit challenge. And again, let me be honest, maybe Heather's kicking me again. Heather, anything disingenuous or wrong about what I just said?
No, not at all.
So bottom line, it comes down to your preference. If you'd rather have an agreement with them or us, again, great partnership. There won't be any he said, she said on this. It's just a matter of getting it done in time. So.
Okay, great. Yeah, because I was looking at it, and we'll still trying to pass it through. We're going to talk about it a little bit more. So, like I said, we can maybe do it once out of a year. I think that would be good, or even twice, maybe.
Right.
With that stuff, just spruce it up a little bit.
Yeah.
So, okay. I think that's it. Just I'll need an estimate, and then we can go from there. If you can send me the contracts and stuff like that, we can take a look at it, get where it needs to go, and I'll get that going on my side. Do you need to know how many employees we're looking at, or?
No, I think using just a rough model of upside 2,200, downside, 1,500, 1,600, is that a good enough window?
Go ahead and just put it up to 1,800. Just
1,800. Okay, got it.
Yeah, that.
Go ahead.
Yeah, and I was thinking 400. I think there are less employees there. So.
Okay. Yeah, that's perfect. I'll definitely put it for 1,800, and knowing it's still a little bit fluid is no problem. So.
Okay, great. All right.
All right. Anything else for you guys?
I'm good.
Okay. Well, Sam, Nick, thank you so much for your time. Nick, thanks for coordinating this and thinking of us. We're really excited to move along. And on behalf of Heather and I, guys, have a great new year. Be safe. And in Party Town, I'm sure it's awful interesting in that state. Are you guys in New Orleans, by the way?
Not quite.
Well, you guys have a good time. Happy New Year as well. And if you need anything in the interim, let us know. Thanks again.
All right, thank you, sir.
Yeah. And I'll get that recording to you as well.
Okay, great. Looking forward to it. I can send that off to them, and they can. If you have any other questions, I'll get in touch.
Perfect. And I am here tomorrow, so if you need anything, don't hesitate to reach out to me as well.
Okay, great.
Thank you so much.
All right, guys. Take care. See you.
Bye.
Bye-bye.